Welcome, and thank you for taking the time to watch this demonstration on meaningful use, how to achieve the core and menu measures. This video demonstration will cover core measure number 8, document vital signs. Let's go ahead and get started. First, let's open up the PDF from the MTBC website which details the Record Vital Signs core measure. This is the Eligible Professional Meaningful Use core measure number 8 out of 15. Record and chart changes in the following vital signs, and here there are 5 requirements: height, weight, blood pressure, calculate and display body mass index, and plot and display growth charts for children 2 to 20 years, including BMI. This measure documents all 5 of these requirements, and they must be met for more than 50% of all unique patients aged 2 and over seen by the eligible provider. And the height, weight, and blood pressure data must be recorded as structured data. The exclusion here is for any eligible provider that does not see patients 2 years or older, or who believes that all 3 vital signs, height, weight, and blood pressure of their patients have no relevance to their scope of practice. So, for example, if there is a pediatric specialist that does not document blood pressure for patients or height and weight, then this would not be required. Let's scroll down and take a look at some of the definition of terms here. Of course, a unique patient. If a patient is seen multiple times during the reporting period, they will only be counted once. The attestation requirements for this are again numerator, denominator, and exclusions. So the denominator will be all of the patients who are seen by the eligible provider ages 2 and over, but the numerator will only be those patients who have at least one entry of their height, weight, and blood pressure recorded as structured data. So if you've seen 200 patients, but you've only documented the BMI for 150 of those patients, then the numerator will simply be 150. There are exclusions here for any provider who does not see any patients 2 years or older. You'd be excluded from this requirement. Or if you see patients who are 2 years and older, but all 3 of those vital sign elements are not relevant to the scope of your practice, then you're excluded from this measure. And of course, the resulting percentage must be more than 50%. Again, you can limit this scope to the patients who are recorded in the EHR. So for example, if you are migrating to the EHR or in the current process of adopting the EHR, you do not need to include patients who are not recorded in the EHR. For this requirement, height, weight, and blood pressure do not need to be updated by your practice at every patient encounter. It's simply that they need to have one entry documented during the reporting period. Let's go ahead and take a look at how this measure is achieved through the MTBC EMR. To open up a patient's chart from the MTBC EMR, use the patient search to find your patient. Let's go ahead and open up the account for Mary Smith. When we open up the account for Mary Smith, we'll be on the Demographics tab. Let's go ahead and click into the Charts tab to get to the clinical documentation. Once we open up the Charts tab, we now have space to enter the vital sign information, including height and weight and blood pressure readings. Here, let's put in a weight for this patient, and a height, and a blood pressure reading. You'll notice that the BMI is automatically calculated at the time of entering height and weight, and the blood pressure is recorded as structured data. We simply need to enter one set of values for these vital signs in order to meet meaningful use for this patient during our reporting period. As the PDF said, we don't have to update these measures every time the patient returns to the office. We simply need to have one entry. However, if you're seeing the patient on another date, it's very quick and easy to update the vital signs, and of course, your medical assistants and nurses are allowed to update these vital signs on your behalf. Documenting growth charts for patients is also quick and easy. Simply select the patient of your choice, go to that patient's chart, and open up a new record. If we have previous entries of vital signs for this patient, a minimum of 2 vital signs, we can go ahead and plot the patient's growth. Selecting the appropriate growth chart for that patient's age will display the patient's growth on the curve relating to that patient's age and weight, or to the patient's BMI for age percentile, or the height for age percentile for that patient as well.